Well, everyone wonders what happens when they get a wound and how are they going to get it taken care of. Now, many times wounds are very superficial, but then there are times when they're not. And so we're so happy to have Dr. Blane Shatkin, who you may have known. He was on my show before. He's actually a plastic surgeon. He was wonderful. We did a lot of seminars, and I guess we really did a lot of radio shows. And so he's calling in now, though, as medical director of the Memorial Hospital Pembroke Center for Wound Healing and Hyperbaric Oxygen Therapy. Big, long title.
Yes, it is. Well, nice to see you again, Anita. But the thing is that I am, as you mentioned, a plastic surgeon, but I'm also a certified wound specialist, and I'm also one of the few doctors who is board certified in hyperbaric medicine as well. I think there might be 1,000 board certified hyperbaric doctors in our country at this point. And I've been doing wound care since I started my practice in 1992, but we opened the wound center at Memorial Hospital Pembroke in 1997. And we've been treating wounds all this time, and we've had fabulous results. And we're using evidence-based medicine, and we are, putting patients into what we consider diagnostic-driven protocols. In other words, you come in with a diabetic wound, it's very different than if you have problems with your veins or your arteries. So we get the diagnosis, we whittle down on it, and then we get you into the appropriate protocol for healing. And we've had fabulous healing rates, greater than 95% over the last 10 years.
That's excellent, Dr. Shatkin. And you know something that years ago when I first got into this field, wound care was not so simple. I mean, they were coming up with all sorts of ointments, and they were the deep wounds, and they were healing from the outside, not from the inside. And then I got very familiar with hyperbaric oxygen with Dr. Neubauer, whom we have spoken about before, and I realized the great opportunity that hyperbaric oxygen really can have. And then I found out that some of the hospitals understood it also. And so for you as a plastic surgeon, you must really appreciate this.
Oh, yeah. Well, we, especially in a hospital setting, we are going to follow, Medicare guidelines in terms of what type of treatments we do. We don't treat patients with cerebral palsy or neurologic injury. We do treat chronic wounds and really what Medicare has kind of deemed appropriate for treatment. And so we do go through insurances, and the treatment for hyperbaric oxygen would include a diabetic wound that's slow to heal. And of course, in any diabetic, the risk of losing a leg or a toe or foot is very high, and we're striving to save limbs. So we are one of the few limb salvage centers in South Florida, and we pride ourselves in that. And so we want to save your leg. We don't want you to get to us too late. We want to try to get you referred to us as early as possible, so that because once you lose a part and you require an amputation of a toe or foot or leg, then you have about a 50% chance of dying in 5 years, and so your chance of dying goes up so much greater. And so we know that information. A lot of wound doctors are out there in our community doing wound care, but they're not associated with these wound centers where we're really going out to heal you as quick as we can, but the most cost-effective way.
Oh, well, that's a great explanation. So I have so many questions. Let me start with this one. How serious is a superficial wound, and can that then become something that would require hyperbaric oxygen? In other words, how does one know when hyperbaric oxygen is required?
Well, the thing is, I don't expect patients to know that, and I don't even expect the community doctors to know it. What I'm hoping is that they're going to refer these patients to us. Well, a chronic wound is a wound that doesn't improve. You can cut yourself and you heal within a week. That's normal healing. Anything greater than a 2-week period that hasn't healed, we want to we would like you to be presented to our center. The thing is, diabetics, as always, need to know, and most of them do. They're taught, to watch their feet for anything. A little superficial scratch can turn into a major infection, and we certainly would not want that to happen. A lot of diabetics lose feeling in their feet. They have neuropathy, and those patients sometimes don't even know that they have something going on the bottom of their foot for a few weeks until somebody points it out to them, because they don't feel it. They could step on a little needle or scratch their foot, and then they wind up with fever chills, and they wind up in the emergency room. So diabetics are taught to really inspect their feet religiously. I know my mom is a very brittle diabetic, and she's 80, and knock on wood, has not had a wound, because she really knows to watch for these things.
It's because her son says, "Mom."
Yeah, make sure you're watching out. But patients just need to be aware of whether a wound is healing properly. I mean, they could talk to their primary doctor, but obviously anything that is persistent over 10 days, it hasn't gotten better, there's a reason why it's not getting better. Now, in the lower extremity, it's not just diabetes. You could have chronic swelling in your legs because the veins aren't working. That's called venous insufficiency. And a lot of our patients, again, are not treated with compression therapy. They're seen by a doctor who is not that familiar with it, and they just send them to Whirlpool, or they send them to the physical therapist. And if you don't put compression on that leg to get the swelling out, then they're not going to heal. So, any kind of chronic swelling in the lower extremity would be a tip-off. Smokers who smoke, that's going to lead to arterial disease, not venous disease, and they could have chronic pain in the foot before they wind up with a wound. A toe could turn blue or feel cold to them. So, they need to look out for those types of things. Smoking is probably the worst, in terms of arterial disease and people really, needing amputations down the road. But, you got to just inspect your feet and your legs. But any chronic wound that's greater than a few weeks really should be seen at a wound healing center.
My guest is Dr. Blane Shatkin, and he's calling in actually from Fort Lauderdale. He's the medical director of the Memorial Hospital Pembroke Center for Wound Healing and Hyperbaric Oxygen Therapy. If you would like to make an appointment, get your pencils out. Remember, this is Pencil Talk Radio. Let me give you a phone number to call. It's 954-384-9997. Again, that's 954.
Wait, hold on. I'm going to correct you.
Okay, well, that's what they gave me. So tell me what you want me to say.
I'm sorry, they gave you that's my office phone number.
Oh, all right. We don't want to do that.
Okay, the wound center is 954-883-8014.
Okay.
I
have it now. 954-883-8014. And I'll repeat that as we go along. I'm very, that's why we have you on. You're so smart. And what is the website there?
Oh,
okay.
It's
right.
probably a Memorial. It's probably you just look up Memorial Healthcare System.
That's what it is.
And there is a website. They've been working on it for quite some time, so hopefully it should be up and running.
Yeah, I think it's MHS, if I'm not mistaken, .org, and then you can go to find the wound center. Are you the only hospital with a wound center of this magnitude here in South Florida?
No, there's quite a few.
Oh,
there's quite a few. There's Imperial Point, Coral Springs has one. There's a lot of entities out there.
So this is becoming quite common.
We are the ones with the highest healing rate.
Okay, highest healing rate. But I would say 15 years ago, this was something that people wouldn't even have known about or heard about. So there's been some sort of a positive result. The positive results, I guess, have increased the institutional direction of wound care centers.
Oh, well, yeah. I mean, I think that people are treated very differently in wound healing centers. I think the patient satisfaction rate is extremely high. We can get you healed. Most of our wounds are healed within 30 to 40 days. getting them into the right protocol. And anybody who's had a chronic wound will vouch for what I'm saying. I mean, patients can get bounced around, and I mean, we see patients sometimes that have had wounds for 7 years. And, just were not appropriately treated or put into the right diagnosis for treatment. But there's a lot of good wound doctors out there in our community, and there's a lot of wound centers out there. We're not the only one, but we do have very high healing rates, and we'll be happy to see any patients who have any questions or concerns.
Well, Dr. Shatkin, let me just ask you a question. So someone would come in, and they would be examined by either you or one of your colleagues. What then happens? Would you kind of walk us through that?
Sure. Well, again, we will look at, your whole medical history. We don't consider, patient coming in with a hole in their foot. This is a terminology that I hear a lot of my podiatry colleagues say. Oh, patient has a hole in their foot. We look at the whole patient, and we want to see what's going on. So if you're a diabetic, we want to make sure your sugars are under control, number one, and we work that out with your primary doctor. We work hand in hand with your primary doctor. And once we have the diagnosis, then again, the protocol is basically the standard of care. A diabetic, you want to get the pressure off the foot. A venous leg ulcer who's swollen, you want to compress them. An arterial ulcer, which is a bad arterial disease from smokers, we got to get them to a vascular surgeon a lot of times. And it's only when we don't get them healed in the first 3 to 4 weeks with standard of care that we move to what we call advanced wound technologies, which is hyperbaric oxygen therapy is one of them. And then the other is sometimes we use these skin substitutes, which can be human skin or skin from pig, that helps to allow these wounds to heal. So we do a lot of advanced wound technologies, but we don't really do that until we know that the patient has failed standard of care.
I see. And are we talking now about people who have other diseases, not necessarily diabetes, but are there other wounds that come from, I don't even know what we could say. Let's say someone suffering from cancer.
Well, I will tell you that we treat a lot of cancer patients that have necrotic tumors. A tumor will outgrow its own blood supply. And sometimes we get patients that are referred to us where they think they have wounds, and we actually make the diagnosis of cancer.
Huh.
And that diagnosis is missed sometimes. Or they're sent to us just for palliative care to try to get them through the whole process of having a big cancer that kind of created a wound. So that's one that you mentioned. But there's also people who have arthritic disease and lupus, which affects the skin, and those patients can get wounds as well. And so again, we're putting them into a diagnosis now where we didn't know how to proceed with the protocol to treat them. So that's what we do. And, of course, we also treat burns. We treat pressure sores. We treat all surgical wounds, so that if, say, someone has a skin cancer, say a Mohs surgeon does a big case and removes a big skin cancer, and they have a wound that's cancer-free, we treat those patients as well.
So it is a very big subject, isn't it? And it's interesting.
Oh, it certainly is.
Yeah, that I really, with all the years I've been doing this, I have had very few physicians, such as yourself, discussing this. It's, I guess, it's a very specialized, profession as part of your medical profession.
Absolutely, and you have to love what you do in anything you do. But the thing is, wound patients, when they're not being treated by a wound specialist who actually loves what they're doing, they get the runaround a lot, because nobody really wants a patient with a smelly wound in their office. Here at the wound center, that's just what we're used to. So, we want those patients to heal. We know we can save their extremity, save a limb pretty much. I mean, there's all these organizations out there now, Save a Limb, Save a Life is one that's been out there for many years. And, it's true, when the idea is for us to decrease your mortality and get you healed and get you moving again as quick as possible.
Let's go back to pressure sores, because this could be one of the more common problems that our listeners have. Talk about what causes them, and do they have to be treated at a wound center, or can they be treated with certain kind of medication and care?
Well, pressure sores generally will happen to patients who are bedridden. Now, say you're hospitalized, you have a hip replacement, you're in the hospital, you're at bed rest for a few weeks. During that time, if they're not encouraging you to move, your backside, you can get a pressure sore over pretty much any what we call bony prominence, which involves the buttock area, the hips, you can involve the elbows even, the back, your head, your ears. It can involve just about anywhere that if you're immobile, and you have pressure for an hour in one area, the muscle under the skin can actually die. There have been all kinds of studies in plastic surgery where, that's all it takes. Say a patient is immobile for 1 hour in one position, say on their hip, that ulcer could be down to bone that quickly. In other words, it's going to be a big wound that then plastic surgery, I do all types of surgery to reconstruct those type of areas as well. So, they can be treated by the primary doctor, but again, wound specialists, plastic surgeons are more in tune to pressure sores than most other fields. But they might require debridements and different things. But that's usually more of a bedridden patient.
But that's so common now with our elder folks, and I think that unless people are really taught how to care for that person, turning them and keeping them clean, that's going to happen, and that is how they can have an early death.
Absolutely. And, the problem is that sometimes it's very difficult for someone at home. We have all types of social situations that are very difficult, where we, the daughters, they've taken care of their mother, and, they don't know what to do at night. She sleeps alone, and she stays in one position. Are they supposed to go in the middle of the night and turn her? The thing is that it becomes a burden for some people to take care of their parents, but they have to realize that, if they're not doing that type of care or getting somebody in their house, then, it can be very difficult. So, it's all about education, which we're doing right now. Obviously, anybody who is taking care of someone who is restricted in their motion, whether they're paraplegic or quadriplegic or they had a stroke or they're just too elderly to move, with arthritis or something, they have to be turned very frequently and watched very closely. And the key, though, with all of this is really nutrition, too. Nutrition, as we get older, we tend to stop eating as much. There's depression involved. There's a lot of things that go into getting these pressure sores. So, we will, we assess a nutrition status. We make sure that patients are getting protein supplements. So, if you were at home listening to this, obviously, and you're caring for someone like this, you'd want to make sure they're on protein supplements, they're turned frequently, you moisturize their skin appropriately. And there are websites you can go to about, how to prevent these type of wounds from occurring, but I kind of just covered a lot of it.
Oh, no, it's absolutely fantastic what you just did. I know you and I have known each other for a long time, but my mother actually wound up because she sat in her, and she had someone with her all the time, and she sat in her recliner too much. And that happened. And they had a bed sore, and they tried to take care of it, and that was just what you said. They had to be turned. She had to be this and that, and before you know it, it really was much worse. So she wound up in the hospital. She wound up in the hospital and had to stay there. It was close to a month, and the doctor said that she's not eating right. It's everything you said. I'm just shaking my head here, and of course you're not in the room here, but we had to make sure she got enough food, and he said if she doesn't eat, she will be dead in a month. I couldn't believe that.
Yeah, and listen, malnutrition is a major cause of that in the elderly, and we see it all the time, and it's not always the caregiver's fault. People
they don't
stop
want to
eating.
eat, right? I don't want to eat that. I don't want to eat this. So you're right. They had a protein drink. We used to do ice cream. We did everything we could, and she did live 3 years later. I mean, for another 3 years, she did all right. But that should never have that should never have occurred. We just didn't know the difference.
Right. Yeah, well, you live and learn, and hopefully some of our listeners are learning what we do and how to take care of wounds, and if they have any problems, then they need to really make sure to get on their phone to their primary doctor and get referred to a wound healing center that has good healing rates. And I can't guarantee they'll be as nice as me, but at least if you come to Memorial Pembroke, then
hey,
you'll
I'm
have
supposed to say that. You're not supposed to say that. He is nice. I know him. He really is nice. In fact, I don't know if we still have him on our website, but if it's possible. But his name, Dr. Blane Shatkin, that's Shatkin, and he is actually he's in Weston. He's a plastic surgeon. He's a beautiful office. You're still there, aren't you?
I am.
Okay, and he is the medical director of the Memorial Hospital at Pembroke Center for Wound Healing and Hyperbaric Oxygen Therapy. So the number to call is 954-883-8014, 883-8014, and you can actually go have a tour. You can find out information. I love Memorial Hospital, and they are very smart there. I'm sure there are even seminars at some point that you may have. And
oh yeah, we do a lot of wound care seminars around in our community, so they certainly can look out for them. But we at least do 2 or 3 a year easily. So
well, anytime you're going to have one that's free and it's open to the public, if you will have them call our office, we will put it into our event page because we think this is extremely important. If you could just have saved one life by this radio show, it was really worth your time.
Absolutely.
Absolutely. I know you're very dedicated. How is your mother now?
Oh, she's doing fine, thanks. She's doing
That's
great,
right.
Thanks.
And you watch out for her. So just before, we have a little bit of time left, and I wanted to get into diabetes for a second because it seems that this is the beginning of what could be very bad for people. And do you think, though, that if people would lose weight and watch what they eat, they can then get off the diabetic medication if it were not, if it were adult onset?
Well, I will tell you, yes, adult onset, it's been very, very clearly shown that it is from, people who are more obese in the trunk area. And, there have even been studies with those patients who have had liposuction. I'm not advocating liposuction for diabetics to get rid of their diabetes. But the thing is, if they lose the weight, we have a lot of patients like that who were non-insulin dependent diabetic. They took a pill and, they lost 10 or 15 pounds and they didn't have to take the pill anymore.
Whoa.
So certainly diet is a big thing. But, listen, having diabetes, I know from my own mother's experiences, it's not the end of the world. You have to be educated. She's a horrible insulin-dependent diabetic, but she's been living with it for 40 years now. She's 80 now, so she's doing quite well. But you have to be educated, and you have to take care of yourself, and you have to watch what you eat. When you're a borderline diabetic, you can't just be eating a bunch of chocolate at night. So you have to be careful.
Yeah. Well, but this whole thing, and of course, as a physician in this field, it has just soared, the people with diabetes, and now we have the baby boomers who are they're loading it on. And I know they exercise. I don't know what this is, but maybe it's something, the kinds of foods they're eating. I have no idea.
Well, look, it's all about fast foods. Our young kids are suffering from obesity. They're serving bad stuff in the school cafeteria. We have to be. When it's $1 to feed your child, fast food versus making them a nice healthy meal, a lot of people are eating fast foods, and so we really need to get back to cooking for our children and giving them good food, good supplement. I mean, not supplements, but making sure they have a well-rounded diet where they're not just eating, tremendous amounts of fatty food and food with a ton of sugar in it. So, again, it's all about education.
I know you're big on
Ms.
that.
Obama is very big with education,
yeah.
and
right.
I mean, with childhood obesity, and I think, when we look at the diabetic rates, I mean, we're expecting them to go much higher in the next 5 to 10 years based on what we see with childhood obesity. So I imagine wound care centers will be around for a long time. But the thing is, we don't really want patients like that if we can avoid it. We want to make sure that people are being healthier and they prevent these type of wounds from occurring.
I know you've always been very interested in people's health, especially your patients. And so are there particular vitamins? Let's say someone is having wound care, not surgery, but they're under the auspices of a physician. They're being taken care of. Is a physician going to tell them they should take certain nutrition?
Well, the thing is nutrition.
I mean supplements. I meant nutritional
supplements are good for anybody who feels that they're not getting enough protein intake. Vitamin C has always been very good for healing. Zinc, some people will get, if they're not eating properly, won't get enough zinc, and zinc is also an important factor in wound healing or just healing by itself. But those three, protein, zinc, vitamin C, those are the main things in terms of healing. But nothing replaces a good well-rounded meal that just has things in it that are nutritionally of benefit and not just going to go through you.
And we don't want older people falling, hurting themselves. They have to go into their home and make sure that there are no loose carpeting and that's a very big, important thing, because I guess as one ages, their healing does not occur as easily. I don't know if they're not getting enough oxygen. Why is that happening?
Well, I think it's happening for a number of reasons. Most likely it's nutrition. It's, just people not exercising, so they're having less, they have less muscle. They might have more muscle atrophy going on. But, just getting back to hyperbaric oxygen again, it's not for every wound, but again, it is, the whole purpose that we can treat so many different wounds that are not healing in the chamber, get more oxygen to the area, get them to heal, and, we have that available to our patients, which is nice.
Thank you, Dr. Shatkin. It was wonderful having you on our show again, and hopefully we'll do it again.
Okay, Anita, thank you. You take care.
You're
okay,
welcome.
bye-bye.
Bye.